Hello. Taking him for a ride around the room. Alright. Yep. Hello, I'm Kathryn. I'm going to be your student nurse today. I'm going to close the door for privacy and I'm going to wash my hands. Can I have you state your name and your birthday?
Elizabeth Blake, 4996.
Okay. Are you in any pain today?
No.
Do you have any allergies?
No.
Okay. Can I have you state your name again?
Elizabeth.
Do you know where you are?
Detroit Mercy.
Do you know what year it is?
2016.
And why are you here?
To film the assessment.
Okay. Patient is A&O times 4. Patient's grooming is intact and well kept. Patient mood is appropriate for the situation and no expressive aphasia for the speech. And now we're going to begin the assessment. Alright, is that alright if I touch your head?
Yep.
Okay, so we're going to start with the head. Head seems normal, cephalic. No lesions or masses noted. Inspecting for any parasites or anything like that. Looks good. Okay. Alright, now we're going to move on to the pupils. We're going to check. Pupils are 2 millimeters in diameter. Now we're going to check for accommodation, so just follow the pen light. Alright, and now just look ahead at my forehead. Pupils are equal and reactive. We're going to check for conjunctiva. No signs of anemia noted. Now we are going to check for, we're going to move on to the mouth. Can I have you open your mouth? Okay. Oral mucosa is pink and moist. And tongue, no lesions noted. Can I have you stick your tongue out? Uvula is midline. Tonsils are 3+. And uvula is mobile. Teeth are white. And mouth or lips are moist and pink. Alright, now we are going to test cranial nerve 5. Can I have you close your eyes? We're going to be testing sensory. So just tell me where I'm touching.
Forehead. Nose. Chin.
Okay. And then you can open your eyes. And can I have you open your jaw? Okay, no crepitus noted. So sensory and motor of cranial nerve 5 is intact. And now we're going to test cranial nerve 7. Can I have you puff up your cheeks? Okay, and raise your eyebrows. Alright, cranial nerve 7 is intact. Alright, now we are going to palpate the carotid arteries one at a time. Alright. Okay, now we're going to listen with the bell for any bruits. Hold your breath, please. Okay. Hold your breath. Alright, no bruits noted in the carotid arteries. Alright, now we're going to move on to the upper extremities. I'm going to check for your brachial pulse. Okay, equal bilaterally at 2+. I'm going to check the brachial or radial pulse. Equal bilaterally at 2+. Now we're going to check for any clubbing, and we're going to check the capillary refill on both hands. Capillary refill is less than 2 seconds. Now we are going to assess the skin temperature, and skin temperature is warm and dry. All right. Now we're going to assess the heart. Okay. All right. Aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, right left sternal border. Herbs, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. Mitral, fifth intercostal space, mid-clavicular line. And at this point, I would listen to the AP rate for 60 seconds with the bell. And I'm going to go back through and listen to the heart for any murmurs or anything abnormal. So no abnormal sounds noted. Now we're going to listen to the lungs. Sorry. Okay. Okay. So just take a deep breath as I move through your chest with the stethoscope. And we're going to check no adventitious sounds. We're going to check laterally. Take a deep breath. Lung sounds are equal bilaterally. And then can I have you turn around and we're going to check the back? Lung sounds on the back. Can I have you turn a little bit more? Okay. All right, take a deep breath. All right. Lung sounds are clear from the back. Now we're going to check the costovertebral angle. Tell me if you feel any pain or tenderness. Okay. And the AP diameter is 2 to 1. Can I have you lay down and we're going to check your abdomen? Or first we're going to check the spine. Spine is midline and straight. And look straight. All right, we're going to assess the abdomen. Turn it down a little. Okay. First we're going to inspect, and I notice a navel piercing, which looks healthy, and skin, it looks intact, and no lesions or masses noted. Now I'm going to auscultate. Bowel sounds heard in all 4 quadrants. They're reactive, and you can listen up to 5 seconds or 5 minutes if until you hear something. Now we're going to percuss for to see if we feel any, or to feel for tympany. So tell me if you feel any pain or tenderness. Tympany noted. And now we're going to palpate, just with 3 fingers in a circular motion. Any pain or tenderness?
No.
Okay. All right. And in the right lower quadrant, we have the right ureter, right ovary, and the appendix. The right upper quadrant, we have the liver, the gallbladder, and the right kidney. On the left upper quadrant, we have the left kidney, the stomach, and the spleen. In the left lower quadrant, we have the left ureter, left ovary, and the sigmoid colon. All right, now we're going to move to the lower extremities. Can we sit up? All right. Okay. We're going to feel for the popliteal pulse, so right under the knee. Pulse is equal bilaterally at 2+. Then we're going to move to the tibial pulse. Okay, interior. Tibial pulse is equal and reactive, or equal at 2+. And now we're going to feel the dorsal pedis pulse. Equal bilaterally at 2+. We're going to check the capillary refill on the toes. And less than 2 seconds, no clubbing or anything. We're going to feel for any pitting edema. No pitting edema. Skin is warm and dry to touch. And we're going to test for the Babinski test. All right. With the pen. So we're going to go. Negative Babinski test. Now we are going to, I'll have you stand up for me, and we will, I'll stand nearby for, and she'll close her eyes for 20 seconds, in case she falls. And then, can I have you walk that way? And I'll watch your gait. Gait is steady and intact. And that completes my assessment.